Welcome to the Enhanced Case Finding Tool, the ECF. In this video, I'll be explaining what this tool is and how it can be used. The ECF tool is a dashboard which allows you to interact with the data we have in the shared care records in order to create patient cohorts for individuals with a certain combination of long-term conditions, test results, or vaccinations, etc. It allows us to filter our population down to a manageable cohort who may be right for further intervention or support, and we can export these lists of patients to understand who they are and potentially make contact. What the dashboard brings through is a whole range of data from the shared coded records, as well as some cube data feeds. If we click on the Show Filter button here, we are able to filter on demographic, such as the age or sex. We can also filter on long-term conditions if we click the disease filter. But we can also explore further cohorts with recent data from GP or hospital visits in the activity filters. And we can also go to our test and vaccination filters to look at things such as BMI, blood pressure, and glucose levels. One of the most exciting elements of the ECF tool is that we work with John Hopkins, who create algorithms that are known as adjusted clinical groups and enhanced diagnostic clusters. These filters, which are a lot more granular views than relying on cough conditions, produce our risk stratification filters, seen here. And these create filters such as your patient need group and the probability of patients being hospitalized. Now, by using the ECF, this is a data-rich tool which we can help to improve and manage our services demand capacity, aiding the ability to build plans for the future. Do note that there are two versions of the enhanced case finding tool. There is the patient identifiable tool, which is for direct care. And within this, when you do your filters, you'll be able to see names, surnames, and NHS numbers. There's also a duplicate of the tool, which is the de-identified, where it filters patients to those cohorts from the filters that have been applied, but you cannot see who these cohorts or patients are. Do note that any searches that are done on the de-identified tool can be replicated in the identifiable tool so that these patients then can be passed on to the most important stakeholders. Hope you enjoyed this video and it gives you a quick summary of how this tool can be used to create cohorts of patients. Thank you.